before I actually met Dr. Stone, I certainly thought that having a knee replacement would mean that I would not be able to do running, tennis, any of those activities. Once I met Dr. Stone and talked with him and talked with his physical therapy, and and I realized that yes, I would be able to do those activities. My name is Laura Oliphant, and I had a I guess knee osteoarthritis that had resulted from a previous meniscectomy. And the treatment that I had at the Stone Clinic was a lateral knee replacement. In 2011, I was pulling up a weed in my yard, of all things, and it was a Scotch broom. So it's a very large weed, but it has a very small root system. And the root system gave way, the weed came up, and I felt a pop in my knee. And my knee, in the next 24 hours, it froze up. Pretty badly, actually, to the point where I really couldn't walk very well. I went and had it checked out. They did an MRI. The MRI was inconclusive, and then they sent me to physical therapy. I went to physical therapy for a year with no improvements, and actually my knee gradually declined in functionality, and it would periodically it would lock up, and it would cause enormous pain. Finally, a year after my injury, a little over a year after my injury, I went to see another doctor. The other doctor said, I don't even need to look at your MRI. I know you have a meniscus tear. You need surgery. I said, when? And so I had the meniscectomy. And unfortunately, after the first meniscectomy, I didn't really get enough instructions on what to do afterwards. And so I went back to doing things too quickly, I think. My knee was never right. It was better than it was because it was no longer locking up. However, I had persistent pain and swelling in the knee, which was limiting my activities. It was I wasn't able to play tennis, which I was an avid tennis player before my knee injury. I wasn't able to run more than a day at a time without having pain. And then I finally came to Dr. Stone earlier in 2022. And we talked about my previous treatments and what was going on, and he took a look at the x-rays and he said, it's time for a partial knee replacement. It's time for a knee replacement. And so I also talked to several other people whether or not this was where I was going, and they agreed with Dr. Stone, and so I decided to go through with the knee replacement. So since I had the knee replacement, obviously it was quite a surgery. Definitely over the last 6 months, my knee swelling has been gradually going down. I have way less swelling than I've ever had, that I've had since my first surgery. And so obviously I went through physical therapy, which was huge in helping the knee rebuild itself and resolve itself. And so my knee is free from pain right now. I have full range of motion, which I did not have before my knee surgery. And that was also one of the major reasons why I went for the knee surgery, because my range of motion was very much impaired. So I have full range of motion. I'm rebuilding the strength in my knee, and I have zero pain. Even when running, I've been able to run a mile with no problem. I've been able to play racket sports with no problem. So definitely a great outcome. I'm going to start skiing in a few weeks, so I'm hoping that will go well, because that was another activity I couldn't do. I'm starting to play racket sports again. Before my surgery, I was very hesitant to do racket sports in particular, because I knew that even though I might feel fine immediately afterwards, within the next 24 to 48 hours, my knee would blow up like a balloon, and I wouldn't be able to walk. So I'm starting to do more of those activities. I'm more willing to do like weight training and things like that, which I was doing before the surgery. And I was doing cycling and things like that, but I'm feeling like I'm able to do them more effectively. Certainly before I had the knee replacement, my mother had a knee replacement, and so my mother is unable to kneel, unable to certainly unable to run. So before I had the knee replacement, before I actually did it, and before I actually met Dr. Stone, I certainly thought that having a knee replacement would mean that I would not be able to do running, tennis, any of those activities. Once I met Dr. Stone and talked with him and talked with his physical therapy, and and I realized that yes, I would be able to do those activities. So one of the important things that I did before I had the knee surgery was that I did prehab in addition to rehab, and so I had the physical therapy working with me on strengthening what I had before I went in for the therapy, and that was hugely important to me. And so I did that for several months before the therapy. So we did exercises, we did to make myself as strong as possible before going into the surgery, I mean. And so, obviously since I had the surgery, obviously coming in and having the having the massage to get the fluids out of the knee and reduce the swelling, and having the exercises, those played a huge role in physically building me up, but also mentally realizing, hey, I can do this. Prehab is huge. Do the prehab, and then do the full physical therapy afterwards, and do the full 3 months that they recommend. I think the recommendations are quite good. I was 80% healed in the 3 months. I was actually able to do, even after 3 months, I was able to do hiking. I was able to do all that. And really, it's follow the recommendations. Make sure you stay ahead of the pain.